see his neck. So he's having some neck issues. So because of the tightness in the neck, there are a lot of alignment changes, especially over the cervical C1 and C2 level. So because of that, so many issues can happen. Especially the major reason, one of the reason is vertigo. So that is what we are going to explain today about the vertigo. Vertigo means it's a medical term. So normally people will say chakkar or a chakkar. So it is called the dizziness. Okay. So why it is happening? Usually it's happening if there is any blood supply, it's not correct. So majorly what the medical treatment for vertigo is, giving vertin. Vertin medicine, while giving vertin medicine, the blood circulation of the inner ear will improve and the excess fluid in the inner ear will be washed out. So the balance will be maintained back. So this is how the medical treatment is. So why the occlusion, why there is stoppage of blood is happening in the inner ear? So that is actually, the vertebral artery which is passing through the, in between the C1 and C2. So if there is any change in the position of the C1 and C2, that will compress the vertebral artery. So the continuation of the labyrinth vessel that is supplying the inner ear, so that is the area of balance. So the blood circulation to that area is getting blocked because of the tightness of the neck. So that is the reason for the vertigo. So we have to adjust the cervical vertebrae back to its normal position. It is not easy as such, which I am talking. So we have to do that. We have to do by the manual adjustment, and we have to work on the soft tissue also. So by doing that, it will become normal and the patient will become normal. So within 48 hours, the patient will become normal. They won't feel any vertigo, any disease, any dizziness. That is how we are working on it. So we must be always careful, especially the neck muscles, like where from morning till evening our work is always related to like this on the desk. So we used to sit like this. So because of our work, the muscles will get tight here. So because of the tightness, the spinal alignment will get wrong, and the blood supply will get stopped here. That is in the vertebral artery. So that couldn't able to supply to the brain. And then especially towards the inner ear, we are talking about the vertigo. So the inner ear blood supply will get lost, so will get less. So the fluid circulation will be more in the inner ear, and the balance can get affected. So what we will do is, by correcting this vertebral by this vertebra, cervical vertebra, this will become okay. So our lifestyle should be maintained, and most important thing is we have to make sure that our neck have full movement. And then also while sleeping we used to keep a pillow over our head. Actually, it is not only for the head. We always keep the pillow not only for the head, for the shoulder also. So a medium-sized pillow that can cover the upper shoulder and the head also. So it should be inside. And you need a towel.
Neck.
Yes. We have to roll a towel and keep it under the neck. So this curvature will be positioned, and the neck position will be maintained. So that also will help in this. So that is very important. So maintain like that, and so the neck issue, it is not only about the neck issue, it is about the whole body. So whole body should be free to move. So then that's how we can maintain a good and healthy lifestyle. So vertigo is not a big issue. Don't be afraid about vertigo. Vertigo, we can treat it very simply. So we can treat it also, and we have to keep it our body. We should know how to move it. So if it is moving well, then we are fit and fine. That's it. Thank you.
अभी अच्छा लग रहा है ना अभी?
हाँ जी।
ये जो आवाज सी आती है ना, इसके बाद एकदम ऐसा लगता है कि मैं नॉर्मल हो गया हूँ। 2 दिन 3 दिन में एकदम नॉर्मल रहता हूँ, फिर उसके बाद फिर स्टिफनेस।
वो आपका लाइफस्टाइल की वजह से ना, आपका लाइफस्टाइल मॉडिफाई करना है, तो आप सोने का तरीका
कई बार हाथ लेके ऐसे सो जाते हैं,
हाँ,
उसकी वजह से भी कुछ।
हाँ जी हाँ जी हाँ जी हाँ जी। वो तरीका ना, वो तरीका में एक्चुअली इट्स अ मॉडिफाइंग थिंग। हमारा लाइफस्टाइल मॉडिफिकेशन करना है, हम कितना मॉडिफाई कर रहे हैं उतना नॉर्मल। ठीक है सर।